Why is a digital rectal exam, DRE, important? Have you ever wondered why a digital rectal exam, or DRE, is an important part of prostate health checks? This simple procedure can provide valuable insights into the condition of the prostate gland. A DRE allows healthcare providers to physically assess the prostate for any abnormalities. During the exam, the provider can feel for lumps, hard areas, or enlargement, which may suggest potential prostate problems, including prostate cancer. One key advantage of a DRE is that it can detect issues that might not yet cause elevated levels of prostate-specific antigen, or PSA, in the blood. The back part of the prostate is where many prostate cancers begin, and a DRE allows the provider to feel this area through the rectal wall. This can lead to early detection of cancers that might otherwise go unnoticed. While the DRE is not as sensitive as PSA testing or advanced imaging methods, it can still identify suspicious areas that may need further investigation, such as a biopsy. The procedure itself is quick, low cost, and minimally invasive, providing immediate information about the prostate's size, texture, and the presence of nodules. In some clinical guidelines, the DRE remains a part of prostate cancer screening, especially when combined with PSA testing. This combination can improve the early detection of clinically significant prostate cancer, particularly in men with elevated PSA levels or other risk factors. For example, if a DRE shows abnormalities and the PSA level is above a certain threshold, it may indicate a higher likelihood of aggressive prostate cancer. However, it is important to note that the DRE has its limitations. It only allows the clinician to examine certain parts of the prostate, missing abnormalities in other areas. The accuracy of the DRE can also vary based on the skill of the examiner and the subjective nature of the assessment. Due to these limitations, some guidelines now recommend more sensitive diagnostic tools like multiparametric magnetic resonance imaging, or mpMRI, as a first-line test when suspicion arises. In summary, the DRE is important because it provides a direct physical assessment of the prostate to detect abnormalities. It complements PSA testing by identifying cancers that might not cause elevated PSA levels and helps guide decisions about further diagnostic testing. The DRE is a quick and cost-effective screening tool, especially in settings where advanced imaging is not available. However, it should not be viewed as a standalone diagnostic test. Instead, it is part of a broader screening and diagnostic approach tailored to individual risk factors. Men are encouraged to discuss the benefits and limitations of the DRE and prostate cancer screening with their healthcare providers to make informed decisions based on current medical guidelines.